Sports medicine is a field in orthopedics that is always evolving and changing, and we're always trying to make improvements in terms of how we can best restore and repair a native joint as opposed to replace it. And so I think one of the common misconceptions about sports medicine is that it's focused on a younger competitive athlete, such as a high school, college, or professional athlete, but that's not necessarily true. All those joint restoration techniques are meant to deliver outcomes to people that participate in recreational sports or do high intensity activities as recreational hobbies too. Athletes that range from their teenage years all the way people into their 50s, 60s, or beyond that remain active with some of their hobbies and activities. In the younger patients, the more common injuries that we see might include injuries to the meniscus or the ACL ligament of your knee. Also, we see a lot of labral problems that might involve the shoulder in a young athlete that participates in contact sports, for example. Maybe into our 30s, 40s, and 50s, rotator cuff injuries are another thing that we see very commonly. With the knee, we see a lot of ligament and meniscal problems in middle-aged athletes too. Those are structures that still need to be supported and repaired as necessary to get you back to the types of things you need and want to do. I think being proactive is the best advice I can give people in terms of when to seek medical advice or care after a musculoskeletal injury, because there are scenarios where things might go on for too long, and in which case our options might be limited. But if there's a type of injury that's really causing pain or limitation with range of motion or strength, and it's been going on for a week or two and doesn't seem to be improving, it's really in your best interest to seek at least an evaluation of what's going on to try to get a better understanding of the problem. Advice in terms of joint preservation is to stay as active as you can. I think that's the number one advice I would have, because mobility and strength of the tendons and motion through the ligaments are what keep a joint healthy and strong. Limiting the amount of impact on weight-bearing joints like your hips and your ankles and knees becomes beneficial. Lower impact activities like biking or swimming or using an elliptical may accomplish those same cardiovascular goals and mental health goals as well without putting the beating on your joints.